Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. Today, our first question comes in from one of our viewers, Darcy, who reached through our website, allhealthtv.com. And this is what Darcy writes. Hi, Dr. Camejo. I've experienced a number of losses recently, and they've definitely got me in a funk that I just can't seem to get out of. I think I'm ready to give antidepressants a try. What are the most commonly prescribed ones, and how do they work? Dr. Camejo, this is a great question. I know many people who are feeling like this today, and I want to tell Darcy, I'm so sorry for your losses. Dr. Camejo, let's help her out.
Sure. So, Darcy, great question. I think that there are several classes of antidepressants characterized by how they actually work or their chemical structure. But our first line of antidepressants usually are based on guidelines and clinical evidence. And one is what they call SSRIs. And those are known as selective serotonin reuptake inhibitor, such as fluoxetine or sertraline. But there's also an SNRI, which is a serotonin norepinephrine reuptake inhibitor, such as duloxetine. So on the first line, other antidepressants can also include atypical antidepressants, such as bupropion, but the selection of which medication to try first will depend on your past medical history, like clinical symptoms that you may be experiencing from depression, side effect profiles of other medications that you may have. So your prescribing physician will have to consider all the factors to see which medications is the best to fit your life. Normally, these start at low doses and then they're increased over time, but your depressive symptoms should be monitored over the first 2 months to see how the medication is working. And if you need, they may be adjusting the dose along the way. So don't be worried about that. At times, you may have to also add another agent to the regimen if they see that things aren't working out, but you'll need to make sure that as a patient, it's going to take time for your medication to take full effect. Antidepressants take a little while to kick in and your body to get used to how they work.
Thank you, Dr. Camejo. Now we have a question from Benji, and they sent this question through YouTube. Let's see what their question is right now. They write, I am pretty depressed and anxious guy who's tried many of the usual suspects like Paxil, Prozac, Zoloft, Lexapro, et cetera, none of which have really worked. So what's the deal with ketamine? Does this work? Dr. Greenwood, let me bring you into the discussion. I've heard a lot about ketamine. So what are your thoughts here?
Well, hello, Benji, and that's a really good question, and thanks for reaching out to us. I'll be happy to give everyone the down low and my thoughts on ketamine. So back in 2019, there was an intranasal formulation that was approved from the FDA that's called S-ketamine, and it's for treatment-resistant depression. Now, to be categorized as someone that has treatment-resistant, it means that the patient would have had to have tried at least 2 oral antidepressants at an adequate dose and adequate duration of time, and still did not have any benefits in their response for the depressive episode. It's also important to understand that this S-ketamine product has to be distributed through an FDA monitoring program due to its potential for some serious adverse outcomes that can include things like sedation, dissociation, respiratory depression, and the potential for abuse and misuse. It also means that the patient needs to be registered into this program, consenting that they are informed of the risk associated with the medications. Another thing to keep in mind if you're considering this agent is that it has to be administered within a healthcare clinic twice a week. So you will have to coordinate someone to be able to pick you up from these visits for the S-ketamine intranasal administration, because you're going to have to stay there at least 2 hours after the dose is administered to see how the medication is affecting you, and you're not allowed to operate any heavy machinery the day that you're receiving those medications. But we did see in clinical trials that about 52.5% of those patients that were receiving the intranasal S-ketamine in addition to their oral antidepressant have remission of their depression episode versus only 31% of patients who had received the oral antidepressant.
Fantastic information. Thank you, Dr. Greenwood. Dr. Camejo, I got a really good question here from Augie, and it's on Facebook. So let's take that question right now. They write, Dr. Camejo, I just started taking sertraline about 3 weeks ago, and I haven't been feeling great the last few days. Headaches, slight dizziness, and some bathroom issues. Could this be from the antidepressants? So we're talking headaches, dizziness, and I love their their mention of bathroom issues.
So yes, most common side effects from antidepressants can include headaches and gastrointestinal issues. However, it's important to keep open discussion with your provider at all times, starting at the lower dose and adjusting slowly, like we have discussed before, to help mitigate those side effects. Now, you can also try taking the medication with food or a different time of the day to see if that helps. But lastly, some of the side effects may go away over 1 to a 2 week period as your body gets accustomed to the medications. Now, if no improvement in your systems is happening, then you need to get reevaluated with your provider regarding an alternative medication, which may be better tolerated. And sometimes you need to take these times to work. Remember, usually 3 to 4 weeks before improvement is noticed. But I think it's really important for people to know what are the potential side effects are they from any medications. So we're going to post them, Olga. So these include nausea, headache, diarrhea, anxiety, sleep changes, weight gains, sexual problems, suicidal thoughts, greater risk of bleeding, and withdrawal symptoms. So you really you can never quit your antidepressants cold turkey. That's really important. You need to talk to your physician so that you can be wind down from your medications.
Doctor, thank you so much. So we have some more questions to get to, but in case you missed it the first time, here's another opportunity to find out where to send in your questions. Take a look.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
And speaking of questions, we have another one from Instagram, and this one's from Adina. She has a non-pharmaceutical question. Dr. Greenwood, I'm going to pose this one to you. They write, hello, doctor. I know you've been talking about medications for anxiety and depression, but I'd love to know what you think about transcranial magnetic stimulation, TMS. What are your thoughts, Dr. Greenwood?
Well, thanks for reaching out, Adina. This is a great question. So transcranial magnetic stimulation, or TMS for short, was first approved by the FDA for treatment-resistant failure back in 2008. It's a non-invasive procedure that uses magnetic waves or fields to stimulate your nerve cells in the brain, and our treatment course can be anywhere from 4 to 6 weeks. Now, clinical trials have demonstrated that TMS to be effective for acute treatment, but maintenance therapy may still be required. So if this is something that you're considering, reach out to your provider to discuss this alternative treatment.
Fantastic. Thank you, Dr. Greenwood. Let's move on now to another question from Raul. He reached out through YouTube. Thank you, Raul. And he writes the following. Let's see right now. He writes, saludos. Oh, that's so sweet. Thank you. Saludos, Dr. Camejo. My therapist recently suggested that I think about trying an antidepressant. As a result, I've been doing some research, and I'd love it if you could explain the difference between SSRIs, SNRIs, and other types of antidepressants. Now, Dr. Camejo, you touched upon that a little bit, but let's reiterate again what the SSRIs do and what the SNRIs do, because one is serotonin and one is norepinephrine, which you just taught me.
So, Raul, gran pregunta. Gracias por comunicarte con nosotros. But so that you know, there are different classes of antidepressants. What we talked about was the SSRIs and SNRIs, but there are also what they call tricyclic antidepressants. There's also MAOIs, which are monoamine oxidase inhibitors, and atypical antidepressants. But to answer your questions, the first lines to treat depressions are the SSRIs and SNRIs. Now, the difference between them and how they work is that SSRIs really increase the amount of serotonin in the body, which is a chemical that helps regulate mood. It actually makes you feel better. It helps you be elated. So the SNRIs also increase the amount of serotonin, but it also increases norepinephrine, which is also a chemical that also plays a role in mood regulation. Now, clinical trials have shown that there is no difference between them in treating the depression. It just depends on how each patient is going to respond to the medication when treating depression. So therefore, it's important to have an open dialogue with your physician or your pharmacist regarding your past medical history and the medications that you're currently taking. They will help you decide which one is the right antidepressants for you to start.
Thank you so much, Doctor. Moving on now to a Facebook question from Shelley, and let's see what she has to write. Hey, Dr. Greenwood, my therapist just suggested that I get some Xanax for my severe anxiety. I'm a researcher, so I quickly discovered that it's a member of the benzodiazepine family. I have an addictive personality, so is Xanax something I should be concerned about? That's a great question. And doctor, I will say I know a lot of people, even family of mine, that take Xanax. So I'd like to hear what you have to say.
Well, Olga, both you and Shelley are asking some very important questions. So benzodiazepines, like opioids, have the potential to become addictive and are some of the most frequently prescribed drugs for acute treatment of anxiety. They are effective in generalized anxiety disorder for acute therapy and do provide rapid relief, but long-term use is not recommended. Our first-line therapies for generalized anxiety disorder can include some of the same medications that we use for depression, such as our selective serotonin reuptake inhibitor or serotonin norepinephrine reuptake inhibitors, which can take weeks to months before you begin to see benefits. So if the benzodiazepines are used for generalized anxiety disorder, the prescription should typically be limited to 2 to 3 weeks and then taken only as needed until that prescribed anxiolytic begins to work. It's also important for patients to be aware that benzos do not treat depression, and that over time, your body can build tolerance to these medications and cause dependency. Now, these medications, if you have been using them chronically for like 4 weeks or longer, you should not abruptly stop them. If to be abruptly stopped, it's likely that you will experience withdrawal symptoms that can include rebound anxiety and even seizures. So if you're prescribed a benzo, it's important to take these medications as they're prescribed, and then include your pharmacist or your prescriber when you're ready to stop the medication so they can provide guidance on how to safely do so.
And Dr. Greenwood, if I may ask something, because I'd like to follow up on this. When my brother passed away, I was obviously extremely sad and extremely anxious. And my father, who's a physician, and my doctor prescribed me Xanax just for a few days, just to help me get through it. And it was just a couple of days, and it helped me a lot. Is that something where you would suggest if someone's going through a terrible loss or a tragedy?
So I think it's a very patient-specific question. A lot of people may have certain situations that can cause anxiety or depression. So it's a conversation to have with them. And I think as long as we're safely prescribing them, monitoring the patient, so using it for short term is a consideration.
Thank you so much, doctor. I appreciate that. And I hope you don't mind me being so personal and ask the doc.
And thank you for sharing with that. I'm also very sorry for your loss.
Absolutely. And it happens to so many people. That's why I wanted to share. All right. So if you've got questions, we have answers. That's why we're here for you. And just in case you missed it, the first couple of times, we want to show you another chance to send in your questions. Take a look.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, Dr. Camejo, I just got a question in from Ruth, and it's on Instagram. Thank you, Ruth. Let's see what Ruth is asking for today. Hi, Dr. Camejo. Are there natural supplements that can be used alongside anti-anxiety medications? I'm asking because my neighbor, Beth Ann, suggested that I take supplements like melatonin, valerian root, and ashwagandha, but I'm concerned about negative drug interactions. Your thoughts here, Dr. Camejo?
So Ruth, I'm so glad you asked me this question, and you're absolutely right to be concerned. Supplements are sometimes misconstrued as being completely safe to take, but like prescription medications can cause interactions and side effects with medications that you're taking. So for instance, some of the commonly used supplements for mental health conditions include St. John's wort, kava kava, or valerian root, can have effect well on other medications and work even impacting liver function. So when considering using supplements for treatments or anxiety, important to discuss that with your pharmacist. You can ask your local pharmacist, can I take this with the current medications that I have? Or ask your physician so they can provide guidance and important information on which supplements would be safe for you and would be more likely beneficial for you as well.
Fantastic. Dr. Camejo, stay right there because we got another question from YouTube and it's coming from Ezra. And let's see what they write here. I've been taking Paxil for about 2 months now, and I'm just as depressed as I was when I first started taking it. Dr. Camejo, how long does it typically take for antidepressants to start working? We kind of touched upon that a little bit a few minutes ago, Dr. Camejo, but if you could be more specific with Paxil.
Sure. Ezra, I'm sorry you're feeling so frustrated, but here's what I'm thinking. And as always, usually antidepressants typically take anywhere between 4 to 8 weeks. It all depends on the person. But it's really consistently at that therapeutic dose. You have to be on the same therapeutic dose for at least those during that time period. Now, if you've been taking Paxil for 2 months without benefit, it's important to then start talking to your provider to assess if it's time to either increase your dose or if it's tolerant, change you to another antidepressant or maybe even add an adjunctive therapy medication. So those are the things you need to go back and say, hey, I'm not feeling it. I'm still depressed. What can you do for me? And your provider should help with that guidance.
Great information. Thank you, Dr. Camejo. Another great question coming in from allhealthtv.com. We love having these questions, and it's from Rena. Let's see what she's asking here. Hi, Dr. Greenwood. My brother has some addiction issues, and I want to help him. My question for you is, how do medications assist in the treatment of substance abuse? And what types of medications are commonly used? So what kind of medications do you think, Dr. Greenwood?
Well, Rena, thanks for sharing your story with us. Now, treatment for substance abuse will depend on what substance is being abused. So that can include alcohol, opioids, benzodiazepines, tobacco or marijuana, etc. But there's always hope and options when it comes to treatment of substance abuse. Now, at times, it couldn't just include supportive care for the withdrawal symptoms as they're slowly discontinuing the drug of abuse. But we do have some pharmacological options for opioid substance abuse, such as buprenorphine, methadone, or naloxone products. And for alcohol abuse, you can consider certain things like benzodiazepines like lorazepam, naltrexone, acamprosate, or disulfiram. But the best place to start is to begin this discussion with a physician who can help connect your brother to those resources and to help him begin his recovery journey and help devise a plan that will work best for him.
Fantastic. All right, the questions keep coming in. This one is from Facebook, and we're going to turn it over to Nacho. And this is his question. Dr. Greenwood, what alternative treatments or complementary therapies can be used alongside medications for anxiety disorders? Dr. Greenwood, your thoughts here.
Don't underestimate psychotherapy and counseling. Very important tool to be incorporated for patients that are experiencing either depression or anxiety. And now accessibility to those resources has greatly improved with the incorporation of telehealth. Exercise is another great option to help alleviate stress and anxiety. And another thing to consider is your intake of caffeine or nicotine products. If you gradually limit your use of those products, it can help limit the withdrawal effects that you may experience as you're stopping those medications. But over time, you'll see it helps to alleviate your anxiety.
Thank you so much, Doctor. Dr. Camejo, I'm going to turn to you now. And this question is from Sandra. She is writing us from YouTube. And her question is the following. Hi, Dr. Camejo. How do medications for bipolar disorder differ from those for depression or anxiety? So the difference between those, if you don't mind, Doctor?
Sure. So bipolar is another mental health diagnosis where patients can be associated with mood swings, and they can range from depressive lows to manic highs. And, one minute they're depressed, the next minute they're happy, they're elated. But first-line therapy for bipolar disorders really include a different class of medications, such as mood stabilizers or even some antipsychotic medications. Now, most antidepressants should be avoided in bipolar disorders, which can worsen manic episodes. So if diagnosed with bipolar depression, discuss with your provider for alternatives for antidepressants. There are a few medications that's shown to be good for bipolar depressions, such as carbazepine or even quintabine. But I would say, please talk to your provider. It's really important that we need to have those conversations.
Thank you so much, Dr. Camejo. Another question coming in again from YouTube, popular site there. This one is from Clive, and this is the question. What are the challenges, Dr. Camejo, in managing medications for both mental health and substance abuse disorders simultaneously? Great question there, Clive. Doctor?
That's a good one. You know, at times, the substance abuse disorder can itself be causing or contributing to other mental health conditions, such as anxiety, depression, psychosis. So it's really important to treat the underlying substance abuse disorder to really evaluate the impact that it will have on other mental health conditions. And lastly, if the substance abuse disorder is not addressed, it can lead to adverse drug effects, expose the patient to more harm. So it's likely to interfere with treatment for comorbidities of mental health conditions. So if you're dealing with substance abuse if you're dealing with substance use disorder, really discuss with your provider so they can connect you with other resources. I think Dr. Greenwood did a great job in talking about other things that you can do to help with that. But resources are really important for this type of condition.
Ladies, we have a couple more questions, and I'm actually going to throw one in that one of my friends is asking me right now. And she was wondering when, and I want to actually get both of you here, when should someone initiate this kind of medication? When does someone know I need help? I can't do this on my own. I've tried diet, I've tried exercise, I've tried everything and anything, and I'm avoiding medications. But when are the signs? If I can have both of you chime in on this. Dr. Camejo, I'll start with you.
So really, I really do think that if the depression has been looming for several weeks, 2-3 weeks, then it's time, and other things you haven't gotten out of your funk, that it's really time to then see if you can talk to your primary care, if they have, have that conversation with them, have them then give you and make sure you are getting some kind of treatment, or if they can put you on a short term, like, if you're having anxiety, like they did for you, Olga, those are things that are really important to have that conversation. Depending on the type of medication is going to be depending on what you're taking. We've kind of gone over that a lot, but really, if you haven't gotten out of a funk and you've been this way for 3 to 4 weeks, it's time to see someone. Dr. Greenwood, what are your thoughts on this?
Yes, I mean, we all have our highs and our lows, and we have moments where we can feel, where things can be so overwhelming and hard to deal with. I think the first thing that we really need to consider is, how is it impacting your daily life? If it's interfering with your ability to function and to take care of your family or take care of yourself, or if it's escalated to the point where you're having thoughts of harming yourself, that's definitely an emergent time to go seek the help. And I just want to get that message across that you're not alone. This is a very common mental health conditions that patients or people that experience from day-to-day basis. And there's a lot of resources that we can connect you to. So, if you feel that these symptoms are causing your day-to-day life and interfering with your ability to do your job, to take care of your family, and you see yourself having these intrusive thoughts where you just really are planning or thinking about harming yourself, don't hesitate to seek that help. There's definitely ways to connect you and to get the help and resources together. This mental health is something that we no longer need to be ashamed about talking about and seeking and advocating for ourselves and for others who may need that help.
And I'm so glad you said that, Dr. Greenwood. You're not alone. And Dr. Camejo, we only have about 45 seconds left, but I thought it'd be nice for you to chime in too on just the stigma and everybody knowing you're not alone. It's okay. About 40 seconds, dear.
No, I agree. I think it's, we all have times in our lives where we're overwhelmed, where it gets out of control. Even just calling a friend, talking about it, things can get better. Having a good support partner or your husband, your wife, having those conversations is important, because all of that, bottling that all inside doesn't make us feel better. So having those conversations, I think, are important. There is no longer anybody to feel ashamed. We all have these days, and sometimes life gives us situations where we actually need help. So don't be afraid to go out and get some.
Absolutely. I appreciate your time. Thank you, ladies, Dr. Greenwood, Dr. Camejo, for all the valuable information. Truly appreciate it, and especially those last words. You're not alone. Thank you, ladies, so much. And that's all the time we have for today. So I'm Olga Villaverde, and don't forget, send in those questions. You saw how to do it, and I'll see you next time on Ask the Doc. Have a great day. Take care.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.